my name is Hariz Hamizan. I am from Group 26 and today I am going to demonstrate on how to shave a male patient. Firstly, we must perform the initial procedure. The initial procedure is performing hand hygiene. Now I am going to perform the hand hygiene. Now I am going to wear the gloves. This might take a while. Now I have completed the initial procedure before shaving the patient. Now it is time for me to visit the patient, and always remember to always greet your patient before you do. Good morning. Now the second step of this procedure is to assemble all the equipment used to shave the patient. Here we have a disposal bin, we have a basin of water, some face towels, shaving cream. Here we have two types of shavers. First is the traditional shaver, the blade. Second is the electronic shaver, but in this case we are using the traditional blade type shaver. And lastly, we have the mirror. It's important for us to make sure that all our equipment are ready to go before we start the shaving procedure. I have assembled all the equipment needed to shave the patient. The next step is to meet with the patient and ask for his permission before we proceed with the procedure. Hello sir, how are you doing?
I'm good, doctor.
Okay, my name is Hariz Hamizan and I am going to assist you in shaving today, if that's fine with you.
Yes, it's okay, doctor.
We have gained the patient's permission, we can now proceed further. The next step is to lift the head of the patient using assistive devices. In this case, I am going to use a pillow. Hello sir, would you mind lifting your head for me? Alright, thank you. It is important for us to make sure that the patient is constantly in a comfortable position. The next step is to place the face towel across the patient's chest. Okay sir, I am going to place the face towel across your chest, if that's fine. Now I have placed the face towel across the patient's chest. The next step is to moisten the skin of the patient and apply the shaving cream. I have applied the shaving cream on the patient. It is now time for me to shave the patient. So I am going to take the traditionally blade shaver and shave the patient. It's important for us to do it in a slow motion in order to not injure the patient. Now I have successfully shaved the patient. The next step is to rinse and dry the skin of the patient using the water and another face towel. Now we have successfully shaved the patient. The next step is to retrieve all the equipment, which is the face towel on the patient's chest, and proceed with the disposal procedure. Final step is to dispose all the used items. The used items are the blade. It goes into the disposal bin. If we were to use an electronic shaver, we have to change the razor blade of the mechanical shaver, and instead of throwing it away. The gloves, you must dispose of them. Thank you, sir, for cooperating.
Thank you, doctor.
And that is the demonstration on how to shave a male patient.